Let's talk about immunity and HIV and AIDS. So just as a refresher, immunity is the body's natural or induced response to infection. In this case, it's the response to the virus, the human immunodeficiency virus. This is a virus that is transmitted through body fluids. So it could be blood, it could be semen, rectal fluids, vaginal fluids, or even breast milk. So there's 4 different stages. During the first stage, the acute infection with the virus, the person might feel a little sick, like flu-like symptoms. They may have fever and malaise for about 2 weeks. And then they start feeling better. So they may not even be aware that they've been infected with this virus. After that, the virus kind of goes into this latency stage. That can last for a long time, could last months or years. So again, the person may not know that they have this virus. Eventually, the viral load will become so great and their immunity will be so compromised that they go into stage 3, which is AIDS. That is acquired immunodeficiency syndrome. It's not an autoimmune disorder because it is an acquired disorder caused by this virus. The way that we stage this is we look at the CD4 count. That is a protein that is on the outside of some immune cells. And we look at the viral load of the virus itself in the blood. So if somebody has a CD4 count of greater than 500, they are in that first stage. So it may not even necessarily be detectable. Once they're in stage 2, their CD4 count is usually between 200 and 499. Anything less than 200 is considered AIDS. So if they remain there, if they don't take the medications that we're going to talk about, and the CD4 count continues to drop and the viral load continues to go up, eventually they're going to become terminal and they will die from this disease. The immune system becomes so compromised that they're not able to fight off any infections anymore. And that can take some time, depending on if they're being treated or not. The treatments now, of course, for HIV/AIDS are so much more advanced than they used to be. It's almost like having another chronic disease like diabetes. As long as you take your medications, you can manage your disease. So the risk factors are going to be anything that can cause the virus to spread through those body fluids. So the population that is the most at risk are homosexual males. They're 79 times more likely to be infected with HIV than a heterosexual male. This is through unprotected sex. So really anybody that is having unprotected sex is going to be at risk for contracting HIV. That is the number 1 risk factor, is unprotected sex, especially if there are multiple partners. Because like I said, you don't always know who has it. They may not know that they have it. Other populations at risk are going to be IV drug users. Pregnant women can transmit this to their fetus in utero. It could also be transmitted during delivery or through breast milk. There is a very, very low chance of healthcare workers transmitting this or getting this disease, from dirty needle sticks, for example. And then there's a possibility of getting it through blood products, although these blood products nowadays are tested so heavily that it's very, very unlikely that that would happen. And just as a side note, if you are taking care of somebody that has HIV or AIDS, it's just standard precautions, meaning good hand hygiene and wear gloves if you think you're going to come into contact with body fluids. So a good rule of thumb is just treat everyone as if they have HIV or AIDS, because honestly, most people that have it may not know that they have it. So you shouldn't touch any body fluids without gloves on. And it is okay to touch a person that has HIV or AIDS with your hands if you're just touching their skin and you're not coming into contact with body fluids. So clinical manifestations, initially with that first virus and introduction into the body, you're going to have those flu-like symptoms. So you might have that fever and malaise. As they progress in the disease, they're going to notice that they start having a lot of infections that they probably shouldn't be getting. They're just always sick. They may have a lot of diarrhea, malabsorption, and anorexia, and all three of those things are going to lead to just a rapid weight loss. That might also develop neuropathy and dementia over time. So diagnosis is made a few different ways. The ELISA is a test that just checks for the antibodies against the virus. So that's going to take some time. So if you have one done immediately after exposure, it may come back as a false negative just because the antibodies aren't there yet. The Western blot checks for an antibody antigen response. So it's a little bit more accurate, but it's costly and time consuming. So our gold standard is the viral load and the CD4 count, and this is what somebody with HIV is being measured for pretty regularly to make sure that their CD4 count doesn't drop too low and their viral load stays low. We want the CD4 count up, and we want the viral load low. CBC may show some pancytopenia. We might do regular pap smears, or we should do regular pap smears, because we're worried about them being infected with HPV, which can lead to cervical cancer, and they don't really have an immune system to fight that off. We may do MRIs to look for lymphomas. If there is an infection, we may need to do some cultures, and we're going to do regular, probably annual tuberculin skin testing, just because they are at such a high risk of developing every infection that there's even if there's just a small exposure to tuberculosis, they may develop it. So treatment involves a lot of medications. These patients are going to be on lots of medications. They're going to be on antiretroviral therapy, probably more than one. So we'll go over these more in class, but just something to know about them is that this is going to be a lifelong medication. They can't stop taking it, because if they do, then the virus will become more active and start replicating more, and that's going to put them at risk of developing AIDS. Entry inhibitors, they are just what they say. They inhibit the entry of the virus into the target cells. So they may also be on a combination of antibiotics, antifungals, and antivirals to try to keep those opportunistic infections away. They're probably going to need antidiarrheals, antiemetics, and appetite enhancers so that they don't have that significant weight loss that you see with HIV and AIDS. So just make sure that you review some of those. Some of the appetite enhancers that you'll see a lot are dronabinol and megestrol. If they do end up developing cancer, then they're going to have to probably be on chemotherapy, which is then going to put them at even greater risk for developing infections, because it's going to compromise their immune system even more. And because they are such at risk of infection, we want to make sure that they're getting vaccinations that they can get. They're probably not going to be able to get any live virus vaccines, but any vaccines that they can get, we should make sure that they're getting them. The complications really have to do with the compromised immune system. They may develop pneumonia. Sometimes they get this, what we call PCP pneumonia, the pneumocystis pneumonia. That is a fungal infection that usually a normal, healthy person will be able to fight off. So sometimes that's our first indication that they may have HIV or AIDS, is that they have this type of pneumonia, and they shouldn't be having that type of pneumonia. Tuberculosis, thrush, and herpes. Toxoplasmosis is a parasitic infection that, again, we should easily be able to fight off, but if somebody has no immune system, then they may become infected with it. That can come from like changing litter boxes. So if you have somebody that's got HIV, you should probably let them know to let somebody else handle that job. Mycobacterium is a bacterial infection that, again, we should easily be able to fight off. Esophagitis and vaginitis, lymphoma is a big risk. And then Kaposi sarcoma is a type of skin cancer that you don't really see in anybody unless they have something like HIV. It looks like small purple painless lesions on the skin. There's a picture on page 493 in Pearson that shows you what it looks like. It's pretty unusual to see that in anybody. The important things to think about, with somebody with HIV and AIDS is to prevent infection. We want to do everything we can to prevent infection. So the number one way we do that is to have good hand hygiene, so teaching hand washing. We want to make sure that they're not sharing hygiene products with each other. We want to make sure that they have clean eating utensils and that the food is sanitary and clean. They probably shouldn't be eating fresh fruits or vegetables because of all that bacteria. We want to make sure that they let us know if they're starting to have any symptoms of any of these diseases, these complications. They should avoid big crowds, definitely avoid people who are sick. So yeah, just make sure that you're doing a lot of good education, almost like those neutropenic precautions that we talked about in our cancer module. So if you have any questions about this, bring them to class. Please make sure you're reading the material. This is just a really quick overview of it. There's a lot more information to it. So I will see you guys in class.